Hi, Dr. Garima here. Uh, Another recording of SBQ for the ADC exam. Right away, let's jump to solving a scenario-based question. I'm little running short on time. My clinic's at 5. It's already 4. So yeah, let's just quickly wind this up. To all the new candidates who are watching this video and are wondering where to get the books and the study materials, I've uploaded all the books in the file section of the Target ADC Facebook group. I'm the admin of the Target ADC Facebook group. You can go there, submit your request to be accepted. I've asked two questions. One is, have you completed your initial assessment? And second, for your email address. Only if you enter both of these answers, then only I will accept you. Otherwise, I will decline your request. And once you enter in the group, you go in the file section in the menu. And once you click on the file section, you'll get all the list of the books which you can download and start studying by yourself. But like I always say, that is all the resources, but you still have to solve the mocks. And this is one of the videos giving you a sample idea of how a ADC question looks like and the way you solve it. Okay. So you have all the books for free, you have all the resources for free. Only I charge for the mocks because a considerable amount goes into making the mocks. Okay. So let's start with the first question for today. You have identified a 10-year-old child with learning difficulties who exhibits poor attendance. So there is learning difficulties, basically a little bit of delayed milestones, and there is poor attendance, meaning he's not a regular attendee to the dental office, which means if you have some long form of treatment, don't expect the child to come and finish that off. So you have to choose certain treatments which are one shot and still helps the child in managing the caries problem as well as the pain problem. New anterior caries. So new anterior caries means already some caries are existing and there is another new caries that is there. And multiple restorations in his teeth. The parent accompanying the child has informed you that the child is complaining of pain in the molar area. So he's come to you, but you see there is caries on the anterior teeth. The pain is not on the anterior teeth. The pain is present in the molar area, and there are already a lot of restorations present in the mouth. So when you see such a type and you see the patient is not a regular attendee, you need to be aware that you can't ask the parents to come again and again for treatments to be conducted. You have to give some treatment which is a long-term, sure shot treatment because you know the child may not come back. So if you plan to do some temporary restoration, ask the parent to come back for a permanent one, forget it. So and your temporary restoration is also going to fall out. Plus, there are learning difficulties. That means delayed milestones. So it's a lot of difficult time for the parent also to get the communication through to the child to do a lot of other life activities, and dental part becomes the least prioritized. So you have to give some treatment modalities which are very easy to do and gives a long-term treatment planning, preventive mostly, not like restorative ones. For example, if you see there is a class 2, then directly put a stainless steel crown. Don't do a filling and expect the child to take care of it because you know the filling is going to come off. So might as well do the stainless steel crown so that at least that tooth is protected. That is what I mean by understanding the characteristics of the child. Anyways, let's see the first question. Now, the most appropriate initial step in management of this case. Very important. A lot of people have marked this answer wrong because they feel there is pain in the tooth, so let's just jump on the diagnosis. The question is not asking you how you're going to diagnose or investigate. It's asking what is your step in management. What does management means? Management means how are you going to manage this patient? Okay, as in all the things which I just said, long-term solution, easy treatments, sure short treatments, this is management. Now, in order to understand what kind of treatment planning you would be doing, you need to understand the caries risk assessment. So the first option, radiographic analysis, this option would be right if the question was asking you what is the investigation. It's not asking for the investigation. So if you mark radiographic analysis, then you have not understood the question. Diagnostic wax up. There is no need for diagnostic wax up. Caries risk assessment, yes. Because if it's a high caries risk, then accordingly you will be giving the preventive plan to the parent. For example, fluoride or mouthwashes or something else. Fluoride rinse prescription, that comes in the treatment planning. So initial step is not fluoride rinse prescription. The initial step is to understand what kind of caries risk the patient has, low, moderate, or high, because that would determine your preventive strategy. Okay. Then I've given a feedback here. Which of the following has the largest effect on caries risk? Largest effect. Now, whenever you have adjectives like this, understand that all the options given to you would be right. Amongst that, you have to choose which would be of the highest priority. Okay. So, type of desserts eaten when meals. Okay. Total amount of sugar in the diet. Correct. Frequency of fermentable carbohydrate intake. More appropriate. Quality and range of nutrients in meal and snacks. Now, out of all the four options, all of them are correct. But like we have studied in the textbooks, that it's the frequency of the fermentable carbohydrate intake that is the biggest culprit than the rest of them. If this option was not available, I could have chosen something else. But since this option is available, I would like to go with it. It doesn't matter how much quantity of sweets or fermentable carbohydrates you are eating. If you are eating, for example, 10 chocolates, but only at a specific time in the day, that is still better than consuming three chocolates at different times of the day. You understand? So, those three chocolates would be more damaging because they have been consumed frequently, one, at a gap of say 2 to 2 hours, compared to 10 chocolates which have been consumed only at one time. Understood? That is what is meant by the frequency of the fermentable carbohydrate. Then we come on to in Caries diagnosis for children, the frequency of bite-wing radiograph examination is. Now, different protocols have been given by American standards, by European standards, but normally it is dependent on the caries risk. Now, let's see the options. Undertake routinely every 2 or 3 years, dependent on the caries risk. Dependent on the plaque score. Undertaken routinely if the patient is socially disadvantaged, dependent on their salivary buffering capacity. See, if I see a child who has zero caries, then I might take it every 12 or 18 months. But if I see a child with multiple caries and every 4 or 6 months I see a new carious lesion developing, then probably I would be taking it every 6 months. So, what determines my frequency of taking a bite wing is the caries risk of the child. Straight as that. Guidelines have clearly mentioned when you are supposed to take the periapical and the bite wing. You can pause the video, go through the explanation. The parents have questions about the x-rays as it is mandatory and are concerned about radiation. Okay. Which of the following should be used to decrease the radiation exposure? Decrease the radiation exposure, either you give lead apprains or you do the digital x-ray or you use an e-speed film or you increase the kilovoltage so you decrease time. Okay. You cannot do the reverse, meaning if you decrease the kilovoltage, you'll have to increase the duration of exposure, which would be more radiation. So it's always increase the kilovoltage to decrease the time. Understood? So prescribe radiograph every 3 years. That is not a feasible option because if you need a radiograph, you need a radiograph. A decrease of the kV to 50 kVp. No, usually it is 70 kVp on which we shoot. If you decrease the kilovoltage, then you have to increase the time, which would be increase in the radiation exposure. So no, you can't do that. Use of lead apron, yeah. Application of a radiation protection badge. Radiation protection badge is not going to protect you from radiation. It's just going to show you how much radiation you have been exposed to, and if it's increasing, then you may have to stop taking X-rays for a while. So that's not going to help. A protective drape for gonadal protection should only be regarded as prudent for a small child. You can give the gonadal protection to a small child. A female patient who is may or may not be, may be pregnant. Yes, sure. All radiographical views other than PA view. No, actually, you give for PA view more. All other radiographical views means you can have OPG and all where you mandatorily wear a lead apron anyways. So my option would be A and B. So yeah, we just solved one. So what you learn from this question is you will Read more about Caries risk assessment. You will read about fluoride, which dosage you are supposed to give for which risk patient, the form of fluoride, the toothpaste content of the fluoride. You will read about radiographs. You will read about the guidelines of prescribing the radiographs. Go open any guidelines, American, Australian, European, and see how many periapicals and bite wings are prescribed to children at what age, and memorize that. Very, very important. There's any question can come from this guidelines. Very, very, very important. So read all these things, and hopefully you like this video and understood the concept how to solve it. Thanks. Bye bye.